The most underrated tool in cancer recovery.
Prayer. Everyone who has an opinion, please keep it to yourself. Part of healing is to acknowledge the grief and the loss.
The phrase stay positive, which you hear so much.
How do you respond to passive aggressive people? Pain is not just physical pain. It's so much more than that. You need to work on all three to achieve the true healing, not just the stabilization of symptoms.
I've been in a room twice when my loved ones were given cancer diagnosis. It's devastating. It's devastating not just for the patient, but for their loved ones as well. What can we do about it? That's the question today. Cancer is not only a diagnosis, it is a shock to the whole body, the mind, and the nervous system. Even as doctors begin discussing treatment, the breath changes, the heart races, and fear settles in before we fully know what to do with it. Research now shows that sleep, stress, nutrition, immune functions, emotional resilience, all these can shape how patients cope with treatment and with recovery. So I want to specify this is not about replacing treatment and medicine. It's about strengthening it along with conventional medicine. This is Anshu Bahanda, and today on Wellness Curated, we're exploring integrated cancer care, medicine, mind, and healing. A conversation about how cutting-edge treatment and whole person care can work together. Joining me is Dr. Chérine Bazzane, who brings together evidence-based oncology with a broader patient-centered perspective on cancer care. Together, we will explore what truly comprehensive cancer care can look like in practice. I have a small request for you. I do these podcasts because I feel like if I can make a difference to even one person with every podcast, that's amazing. So please help me. Please share these podcasts and do subscribe to it. It's free. And the only thing I ask you to do is share it and subscribe to it. Thank you. Welcome to the podcast, Dr. Chérine. I'm so delighted we could finally make this happen.
Me too. Thank you so much for having me.
Thank you. And thank you for coming with all your various commitments. I'm really grateful.
Thank you. I'm very happy to be here.
Lovely. Now, the first thing that I want to ask you is when someone is diagnosed with cancer, irrespective of the prognosis, there's this overwhelming fear which seems to take over. It takes over the patient, it takes over the family. How can we help people with that?
So, allow me to introduce a little bit about my work, if I may, and then answer your question from that angle.
Okay.
So I'm a family physician by first hat. That means that when I trained in medicine, I was trained to look at the whole picture, look at the whole diagnosis, look at the whole person. Still with a conventional eye, of course, when you do medical, regular medical or mainstream or allopathic medical school, which is 11 years for me to graduate family medicine, I was taught to look at the whole person, but never at their fears, never to know how to truly communicate with them. So I did learn how to break bad news, which was one course over the span of 11 years. It was like an hour and a half, and that's it. That's about the training I had for how to break a bad news for someone who's been just diagnosed with a serious illness, whether that be cancer or other, right? And unfortunately, the cultural conditioning or the cultural thought is that as a doctor, you need to tell them, yeah, but you stay strong, you stay positive, right?
Yes, yes.
And in my opinion, that is absolutely not what is needed at that moment. Because that person just received a slap on their face.
Absolutely.
And part of healing is to acknowledge the grief and the loss that is going to be faced in the upcoming month. Yes, not to be desperate or despair, not to fall into despair. That's the most accurate word. But dealing with the deep difficulty of the emotion that will arise is part of the healing journey. And bypassing that is just bypassing the journey itself and looping into more coping mechanisms that are not going to serve the root cause of why the disease appeared in the first place. So first, acknowledging that the person in front of us just had an immense shock to their life.
Yes.
And that grief that they're going to do for themselves and their old identity is going to go through phases of complete denial, phases of raging anger at life itself and at themselves, perhaps for making maybe bad choices, or everyone has their own story,
has their
right?
way of dealing with it. Yes.
Then they were going to go into bargaining with life, with God, perhaps, or, with like, why did this happen? And I'm like, bargaining. But if you give me cancer, then at least you're going to, right? They bargain things. And then they're going to accept it. And this is where I think this is the hardest part, but the most magical part. And then there's the the transformation. That's where like the healing happens. That's where.
So how long do you think this process takes? From the time they hear it to acceptance on the average? Of course, every person, like you said, is different.
I'm going to answer from my experience, not from the books.
Okay.
Yeah. Because the books, books tell you something that, as if this journey is a linear journey, right?
That's why I have you here, because I heard you talk.
Yeah.
And I decided that, it's not what the books say exactly. When you're feeling something so immense.
So the book says 6 months. That's what the book says. And the book gives it in a way that this is like a linear journey. Like first there's denial, then there's, anger, then there's bargaining, etc., etc. What I feel is that in one single day, these people who are dealing with strong, I would say storm in their life, they're fluctuating all these emotions on the same day or the same week, right? It could be 2-3 days of denial, then they go into deep grief or despair or, depression, then they can have, hope again or acceptance. So that's like waves of emotions that are coming and going and coming and going. And the wave starts strong at the beginning, but then they ease out. And this, when they're easing out is when that you're finally into acceptance and integration. So I think 6 months is fair, but in my experience, 18 months is the true identity shift. Yeah, because if you take like the most common, like I would say, cancer that I saw in women, which is breast cancer, right?
Yes.
I always tell the woman, between the shift in your life that you had to deal with that first appointment with your oncologist or your physician who's, breaking that news to you. If you've been through surgery or chemo or radiosurgery and chemo or whatever it is, right? For you to find yourself again, you have to have completed all of this. So including if you've received surgery, chemotherapy, radiation, that's about a year at least in terms of treatment, depends on the protocols, right?
Right.
And then for you to integrate the experience, it's 6 months on top of that.
Okay.
And then I think that is the window of transformation, 18 months.
So I've been in the room twice when loved ones were given the diagnosis. And that's why I asked you about the fear, even before we get into talking about integrated cancer care. Because, like you said, the fear was so overwhelming that just talking about the care, the treatment, it all just seemed to fade away.
Yeah.
So tell me about cancer care, about what is integrated cancer care, and how do you approach it when someone is going through this diagnosis?
I lost my father to cancer.
Oh,
I think
gosh,
this
I'm
was
sorry.
I think this was the why I went into cancer care, although I didn't want to go into cancer care. Like I even said, if cancer care was the only thing that's left, I'll quit medicine.
Gosh. But my daughter had cancer. That's why I do these podcasts.
Yeah,
Touch
I'm
wood.
so
She's
sorry,
really well. But at that point, when she was 1.5, it was devastating.
Yeah.
So,
Bless you.
so I know exactly.
Yeah.
Yeah.
It's it's a journey, you
it's
know?
a crazy
Yeah, it's a
journey,
crazy
yes.
journey. So why did I start with that story? Because what is integrated cancer care? I did not have that answer. Being a doctor who studied for 11 years, I was already a doctor and a specialist when my dad got cancer. I was already a family doctor in residency, final year of residency. Believe me when I tell you, I had zero clue about any of what was going on. Even with 11 years, 11 years, right? But what I saw is that care is fragmented.
Yes.
Like this
Yes.
was clear to me. Care was fragmented. We had the oncologist obsessing about the chemo protocol and the doses, and that was about it.
Yes.
Right?
Yes.
And then we had the palliative team obsessing about morphine or not, and that was about it, like pain and pain management. But even when we got to the palliative team, it was already too late.
It was, yeah.
We should have went with the palliative team long before, not for palliative care, meaning terminal care, but for active
pain management.
Yes,
for active pain management.
active human management.
Gosh.
Right?
Yeah.
They're just pain. Like pain is such a big chapter. Pain is not just physical pain. Pain is caregiver pain, it's patient pain, it's systems pain. It's so much more than that. But still I was too young to understand, because also I was involved. I was a daughter. I wasn't a doctor.
You were emotionally
Yes,
involved,
I was involved in the whole
situation.
situation.
Yeah, yeah.
But the personal experience as a family member who is also a doctor, and he was a doctor, to that full experience, right, told me if I have presumably all the knowledge, and my father who's a doctor has all the knowledge, and we've been through that, people who have no knowledge of biology and no knowledge of the medical system, and they don't even have anyone on the inside who's talking to the nurse or, you know, understanding like the small little things that can really make a difference to my dad, like his food or like things like that. What would they do? Like literally, what would they do? Like, oh my God. And I was like stunned of that realization. And I think part of my inner soul going into cancer care was just to be able to save or salvate some of the pain that we couldn't, or I couldn't do for my dad.
Right.
So there, I started working soon after I graduated in cancer care, and I realized that there is a need for not just a family doctor to be there. What does a family doctor mean? A family doctor is someone who studied 7 years of medicine and then specialized in a non-specialty.
So this is like a general practitioner,
yes,
correct?
But not just 7 years. It's 7 years plus 4 years of deep residency and sciences and a lot of tools. Because if you do 7 years, trust me, it's really nothing. It's like, you know, nothing. You're just learning biology, but you're not learning the clinical, the human, right? Then integrated care starting becoming obvious. And this was looking at the person as a whole, as an entity, and not just as an organ that is damaged or sick. Looking at fear, emotional pathways, hope, pain, psychological support, nutrition, recovery, sleep, movement, being part of their treatment protocol, community being part of their journey, and getting the right people involved and getting the right people talking to each other.
Yes, that's a very
I'm
important
sure
fact.
you've noticed that.
But tell me, at that point, people are so overwhelmed that they just don't know what to do. Now you've got all these specialists. How do you manage who talks to them? Do they all talk to the patient?
That's a fragmented model. The integrated model, you have either a nurse, an integrated nurse or integrative nurse, either a GP that is doing all the communication with the person and their caregiver.
Okay.
And if you're anything like coming, I come from Lebanon, so all the family needs to be involved.
Yeah.
So sometimes I repeated the same information for 17 members. Like, I'm not joking. So it's important to have one caregiver for that, or two, right, for the person.
Okay.
And so one person should be communicating with one or two persons at most to keep that clarity. Otherwise, the communication will be fragmented. Of course, the oncologist will come and communicate, but the oncologist only, doing the protocol. Few oncologists, there are oncologists that are integrative in nature, in approach. For example, I was lucky enough to work with my mentor and colleague back in Lebanon, who was an integrative oncologist by spirit.
Right.
So he was the one who actually got me inside the cancer care, and his approach made it possible for us to help more people genuinely, not just cure the disease, but feel well.
So, can you explain to people listening what it would mean to have integrated cancer care? So, what are the different things that would be offered to them and that would be handled?
Yeah. I'll give you an example, like a question. So oftentimes I would get my patient ask me, "Doctor, is it true that sugar will cause the cancer? Doctor, can I eat everything? Is red meat bad for me while I'm on the treatment? I was told I wasn't supposed to drink alcohol, but I just finished, and it's my birthday," and simple things.
Everyday questions.
Everyday questions. Honestly, the oncologist doesn't have time to go for the evidence, and fairly so. They're too busy doing much more difficult things, right?
Yes,
Maybe.
yes.
Not that it's better or less, it's just different job description, right?
Yeah.
So you have to have a person who takes care of the lifestyle aspect, of the functional aspect, of the nutrition, gut health, movement, psychology, the spirit, I mean the morale, the psyche, and a psychologist perhaps on the team, an integrative nurse on the team, pain management. So this is the integrated model where the patient is at the center of care, where the outcomes are based on their satisfaction and their quality of life rather than if the tumor shrinked or not. Right? If I have an imaging where the tumor is shrinking and we're celebrating, but the person can't get out of bed,
and the person's gone into depression or something like that.
How do you say this is health? This is not health.
I remember the doctor saying to us at that point, amazing, brilliant oncologist, but she was a baby. She was 1.5, and we were like, what should we feed her? Exactly what you said. And we were told, he said, whatever, just make sure she eats. Give her chocolate if she wants chocolate, give her whatever it is that'll make her eat. So like you're saying, their job, the oncologist's job is to deal with the cancer itself. The organ that needs to be dealt with. So amazing. So you have a nurse or a GP at the center of it who deals with you along with your oncologist, and who will maybe take you to give me some examples. Maybe recommend hyperbaric oxygen,
or
maybe
ozone therapy.
Yeah, ozone
therapy.
A nutritionist if required.
Yes, and supplements.
Maybe a psychologist.
A psychologist.
Yeah.
And that gatekeeper is the one communicating with the whole team, so that the patient doesn't carry their file and fragments the file in different offices. So even forget about cancer, but just as an example, how many women do you know that have their files because they have bloating and brain fog at their neurologist office and their gastroenterologist office and their GP's office and perhaps their orthopedic surgeon's office because
they don't know what it is.
Yes. So that is integrated care.
Yeah.
That's one contact point, multidisciplinary team, communication inside the team, patient at the center of everything. Outcome is not just organ-based, but quality of life-based.
Okay, so just coming back to the fear aspect, what I've seen a few times is that people are being very strong on the outside, right? Because of the state of the family. Like you said, families start falling apart, caregivers start freaking out. But they're terrified on the inside, even though they're putting up the strong front. How do you help them?
Yeah. If the GP or the person or the nurse in charge isn't qualified to offer emotional support, then you use a psychologist who is trained in these types of matters, right? This is the real model of care. But I would say, to add to that, I would say the best thing to do is to train all healthcare givers, to train all practitioners inside an integrated department to understand what is the true science of listening and the true science of emotional communication. So it's not just the psychologist who needs to take that part. I had to learn this myself. I had to learn that I've never been taught to listen. I had to learn what was said and what was unsaid, right? I had to really, really listen to deeper than what's being spoken about.
Yeah.
And in my opinion, that is the forte of helping people deal with things they don't even understand. You develop, you develop,
their blind spot
exactly. You develop an intuition and an ability and the skill to tackle patterns and blind spots as well. Blind spots that might be the reason why they healed or not. Truly.
Absolutely. I agree with that. Now tell me, you mentioned family, which, like, I'm Indian, you're Lebanese. A lot of my friends internationally, we're all very involved with with our families. And very often what happens is, what I've seen, that you want to help, families want to help, but it becomes pressure. So what advice do you give them and how do you handle that? Like you're talking about one time you had to talk to 17 family members. What advice do you give them to handle the patient?
Yeah. Everyone who has an opinion, please keep it to yourself.
Right.
That's the first advice I would give.
Right.
Because even if you think you know better, at this moment, you don't. And at this moment, if the person didn't ask for your advice, probably your advice is a bit hurtful rather than saving advice. So if someone asks for your advice or for your help, you offer it wholeheartedly. If they don't, you just give love. Your job is to be present and give love and to respond to the help that is asked of you, right? Now, the caregiver who is really all the time handling medication, perhaps painkillers, handling care, handling night shifts, whatever it is, this is the person where they can actually advise or lead.
Right.
You need one co-pilot for handling that journey.
Right.
But not everyone is a co-pilot. Let's determine who that person or two people maximum who are doing shifts are, right? Let's determine what is the best way to communicate with the patient to their preferences. Sometimes talking too much is not good. Sometimes staying silent is better. Just holding space, really. And minimize visits, I would say. I mean, we know you want to come and support, and that's beautiful. Sometimes a short visit or a text message or a heartfelt gesture means so much for the person who at the moment is dealing with so much information, so much input, so much data, and so much internal fears and transformation that your energy isn't required at the moment.
Yeah. So someone told me a story the other day, which happened with her. Her daughter was going through treatment. And a relative, actually, they didn't allow anyone in because of her immunity. So she, 3 times a week, would leave food at the entrance. I mean, that was just a simple gesture. She didn't go in. She'd leave the food. She'd ring the bell and she'd leave. That is help, right? So when people want to help, find ways like this which can be helpful.
Yeah, my best friend is going through a journey right now.
Right.
She's in Paris.
Right.
So I know I'm supporting her from afar, but I wish I could just leave food at her door, right?
Right.
This is such a she thing that she needs, gestures. Anticipate what they could need without you being aggressive inside the space. Just be of service.
Yeah. Because what I've seen is sometimes when aggressive is a good word, because sometimes when people are trying to help, but they feel like they're not reaching, they feel like they're being shut out, but they're not. It's just that you're so busy dealing with your situation.
Yeah, it's not about you.
Yeah, it's not about
Don't take it
the
personal.
family.
It's about the person
It's
who is
about the
going
patient.
through the transformation.
Exactly. The other thing I want to ask you is, a lot of times when people are going through cancer, they completely feel like there's a loss of control over their whole life, over everything they'd worked on. What do you use here that could possibly help them?
Surrender. That's a big one.
That's a very big one. Yeah.
Surrender.
Yeah.
Because the loss of control, it's what is needed to let go of the old personality that wasn't serving and that got you sick. So this is the hardest thing. The hardest thing to do is to trust and surrender. However the process moves, do what you need to do. Listen to the right people who you trust and you have appointed to be your trustees at the moment, and surrender to the rest. And it's so hard, right?
It's very hard.
You know, I'm
not.
not. Yeah, I'm
That's
not
very hard.
Yeah.
I mean, that is. I mean, when you look at Vedanta, that's the crux of the Vedanta: surrendering to God, the universe, to a power. That is such a hard thing to do.
And I do understand that.
Yeah, yeah, and yeah, you've been through it, so it's very hard to. And what about the physical exhaustion that people go through?
Oftentimes, what I see is people demand so much of themselves,
Right.
especially when they're too tired to handle.
Right.
So as if they want to keep the old performance with the new transformational journey. We want to be kind. We need to learn kindness towards the body. The body is going through this because probably we didn't know how to talk to the body in the first place. The body is going through this because it had to revolt to get your attention on things you were not paying attention to. The body needs kindness and compassion at the moment, and sometimes accepting the fact that you're weak and you need support and you need merciful kindness to yourself is the lesson. And once you accept that your energy lasts until 12 p.m. and that you can't see everyone and that just thinking about your food takes the whole day, and then a walk of 10 minutes equates a walk of 50 or 60 minutes, but you show up for these little milestones, like these micro milestones. I think these are the micro wins that will be tremendously effective for your healing.
You said something here which I thought was really interesting. Talking to your body. Talk to me more about that.
Yes, I think this is my mission right now. Moving from cancer care, I discovered that my mission is to help people not get sick in the first place.
That's what I was trying to get to.
I felt that we did not learn the true language of the biology and the body. I felt that what if there was an encrypted language that was never taught to us as humans and doctors, frankly, that makes us miss the signals before symptoms? What are these signals? And what is the language of the body? How is my body communicating to me? I will give you an example. I had a patient today in my office who's not a cancer patient, who suffered for 12 years almost with fibromyalgia, which is chronic pain very bad pain.
Can be excruciating
pain. And depression, and she's on so multiple problems. And she's telling me about a brutally painful story in her life that the pain started at the same time that this brutal story started. And she's telling the story without any emotion. She's like, as if it's not the person who is going through the story. Even I, as a listener, listening to the story, I could feel my stomach, cramp.
Yeah.
A cramp. And then I had nausea. And then all I wanted to do was to run and vomit. So I was feeling what she was supposed to be feeling in her body at the time of that story. But because, especially women and men, we were taught to silence our body. We were taught to be good girls. We were taught to, be strong. The community wants us to be individuals. All of these fragmented conditioning ideas lost us the connection with our body. So what is it to listen again? What is it to really understand when I'm too tired to get up and do what I need to do because I need to do it and people are counting on me? What does that look like? How can I be so aligned with what the body is saying,
Telling you.
with my tension that is here, with that weird feeling as if it's not me, or like, how can I listen deeper to that? And if I do, and if I learn the code with which my body speaks to me with, perhaps that is the true key of prevention.
I agree with you. And the other thing I actually think, which I say to people, is actually talk to your body. Talk to yourself, talk to your body, talk to your mind.
I always do that.
We think no one's listening, but
No, yeah.
a lot of times people's initial reaction is to laugh when I say that. But it's so important. If something is paining, talk to it and say, what did I do wrong? Have I, this knee, have I used you badly?
Yeah.
Have I worn 6-inch heels and danced all night in them? You know?
You'd be surprised to hear the answers. You'd be surprised if you listen that the answers are brilliant.
So I want to ask you about identity and confidence, because that goes for such a 6. So what, besides, taking someone to a psychiatrist and helping them through that, what would you advise people do? Is there something we can tell them here?
I will say it. The psychiatrist is not the answer. Yeah, really. Like, it might be the answer when things are too advanced. Let's hope things don't get to that point. A psychologist is a great point to start, like verbal therapy.
Okay.
But I would say transformational journeys in nature where you truly try to meet yourself. And I know this sounds abstract. Like, what do you mean if I want to love myself or meet myself? The moment you understand what would require of you to look at your entire psyche, at your entire subconscious, to look at your fears, to look at your conditioning, to look at your upbringing, at your values, at your belief system, at your attitudes, at your reactions, at your behaviors, the moment you see the pattern, you can break the pattern.
So you're saying you've got to help yourself. No one else can help you. And I guess that's there for people who are totally shattered by the diagnosis as well, that what has led to this? What is the pattern? You're talking about patterns, which they talk a lot about. And
you can't give your power away when it comes to your health. You have to take your power back, and you have to trust that you can figure it out with the help of trustees who are professionals in the field.
So for people listening in, do you have any tools or techniques which would help them? Because not everyone's based here, not everyone can come to you. Our audience are all over the world. So what tools and techniques can you give them?
Free tools that are tremendously useful is your first 15 minutes in the morning. Your morning routine, your morning ritual is as sacred as your health. Free that space. Don't have noise in that space. Don't pick up your phone. Don't read your emails. Sit with yourself. Perhaps meditate. Listen to what's surfacing. Listen to your emotions. Journal. Journaling is a tremendous free tool. It actually has evidence-based, science-backed, outcomes on quality of life in cancer patient, on healing after surgery, on wound healing. I mean, it's crazy, the evidence on journaling, physical evidence. So these two tools are like, it's where you kind of release your emotions and where you align with yourself.
It's amazing, but everyone talks about journaling. It doesn't matter what field, what area, and I love my mornings. Those are, like you said, very special. Now we're going to do a rapid fire round. I'll tell you a word or a phrase, and you tell me your instinctive response. So Google diagnosis after a cancer scare.
You're just condemning yourself to sleepless nights.
Thank you. Detox juices during chemotherapy.
Fad diets.
Meditation.
1,000,000%.
Wow. The phrase stay positive, which you hear so much.
How do you respond to passive-aggressive people?
The most underrated tool in cancer recovery.
Prayer.
Oh, amazing. Amazing. Thank you. Is there anything, the last thing you want to tell people before we go?
A human being is psyche, body, and soul. Any illness imbalance inside a human being is an imbalance of all three, not just one. Targeting just organ is a I would say a useless slash missing skill, or a missing treatment, or a missing,
Missing the rest of the picture.
yeah, it's missing the
Yes.
rest of the picture. So I guess we need to work on all three to achieve the true healing, not just the stabilization of symptoms.
Thank you. Thank you so much, Dr. Chérine. I've thoroughly enjoyed this conversation, and I hope people start looking at things in a more integrated way.
Thank you so much,
Thank you.
Anshu. It
Thank
was
you
a
so
pleasure.
much. Take care. That was such a thoughtful and grounding conversation with Dr. Chérine Bazzane. If today's conversation highlights anything, it's that integrated cancer care matters because it recognizes the full reality of what a person is going through. A person is not just going through cancer. They're going through all this anxiety. They're going through all this worry. They're going through nervous system collapse. Cancer can be treated, and it can be treated more and more successfully every day. Cancer care is becoming increasingly personalized. But treatment does not happen in isolation from the rest of the body or the person living in it. The immune system interacts with stress hormones, recovery interacts with sleep and nutrition, emotional support influences how patients engage with cancer. And integration does strengthen outcomes. It does not compete with them. As our oncology continues to advance, the future of cancer care may become more collaborative, more personalized, and more attentive to the whole human being undergoing treatment. This is Anshu Bahanda. Take care of your body, support your mind, and remember that medicine and healing are more powerful when they work together. Thank you. And we get you these podcasts for free. Our mission is to help people. We feel like if we can help even one person per podcast, that's a huge service that we can do to you. Please help us by sharing it and subscribing to it. Thank you.